and we're going to start out with our first guest, which is Christopher Logue, and also Joanne Cocozzoli, and we're going to be talking about HealthShares. What's HealthShares?
So HealthShares is an innovative project that the Schenectady Health Department, as well as Cornell Cooperative Extension and Schenectady ARC and Ellis Hospital are partners on. And the main idea of the project is that we know through some of the health data that we have a lot of residents here in the city and the county who are at risk for cardiovascular disease as well as other chronic ailments.
And you're trying to turn that around.
And we're trying to turn that around. And also we know that food and nutrition plays a big role in that, and access to fresh, healthy foods. So our project is that we are actually growing produce at the greenhouse in Central Park on that property there.
Great place. Yeah.
And Ellis Hospital refers patients to us, and they come twice a month for a pickup of fresh food from us. And when they do that, they also are getting probably a 15 to 20 minute nutrition education lesson.
What kind of vegetables?
I
love food. All kinds of stuff.
We have all kinds of different things.
Lots of kale?
Actually, kale was the first thing we had in production, and I think the kale just came out last week. And to date, we've distributed over 6,500 pounds of fresh vegetables that were grown right on that small site.
3 tons plus.
Yes, and that's really, it's really impressive when you consider that a lot of that is things like kale and other types of greens, which are not all that dense as far as their weight is concerned. They have lots of good nutrients in them, obviously, but they're not heavy. And once we got into the tomatoes and the peppers and the things like that are a little bit heavier. The numbers really began to go up. So we have about 115 participants in the program right now. It is beginning to wind down because of the season coming to an end. We're going to be doing our distribution.
But my greens are doing great.
Yeah, absolutely. We haven't had a frost in the city here, actually, and we think we can continue to produce things here well into November, probably. And then sort of the bigger idea going forward is that we really look at this as sort of maybe a new way to market local foods, to market local products. We modeled this in some respects after some of the health plans who will subsidize your gym membership, because we know exercise is another thing.
Some of the other
exactly.
Ones. Exactly.
And so, sort of the sustainability piece of this that we hopefully will be working on and have been working on, continue to next year if we're funded again, is to try to get some of the health insurers to look at this as well as some of the local farmers to look at this.
We really need to look at now. Joanne, when do you think you'll see whether this is working? And do you help people learn how to cook? Because a lot of people really don't understand how to.
Well, and I think the first thing, what we looked at was that we saw that in Schenectady County, cardiovascular disease, heart disease, does impact us. It's one of our leading causes of death in Schenectady County. We looked at the rates of obesity. We have a high rate of obesity in Schenectady County compared to compared to New York State. So what we looked at was, wow, we have an unmet need here. How can we creatively take care of Schenectady County and Schenectady City? What are we looking to do here? So what we did was we partnered, as Chris had indicated, and we said, unmet need, what will we do? And we created this innovative process where we work with our partners in our community so that the doctors prescribe, they give a health share, and it allows individuals who are at risk from cardiovascular disease. Right now we're working with adults, so individuals with
it'll trickle down to kids.
It will, because as families come in and redeem their vouchers for these food products.
So they're real vouchers.
They're really vouchers.
Okay.
And what we're doing is when the physician issues the voucher or prescription for the fresh vegetable, we then at the pickup location, as Chris described, we have nutritionists there. We also have nurses there. So the nutritionists focus on the health nutrient of the food and what they're getting, also instruct people on the recipes, because if you're not familiar with the vegetable, how do you know how to cook it? And also
hand a person a rutabaga and they're going, what do I do with a rutabaga?
Exactly, and they're great recipes,
I love it,
really good. And then the other thing is we have nurses up there taking blood pressures,
so it's
weights.
a follow-up as well.
So it's a follow-up. So we're looking to see from the time a person starts the program And then at each interval where they pick up their vegetables, and then at the end, and then 6 months later, we'll work to see, have we made an impact on this? Have we seen a reduction in blood pressure? Have we seen a reduction in the use of vegetables and people's knowledge? Has it increased? So I think we're looking at a couple different areas and the impact we can have here in Schenectady County.
Now, suppose I'm watching this right now, which I hope you're watching. What if someone is watching and says, I'd really like to get involved with that program? How do they do that? Is it they talk to their physicians?
So they would talk
or health practitioners?
They would talk to their health practitioners, and you know, this year we were pretty limited to practices up at Ellis. As we go forward, we can look at other options and other practices.
So if a physician is watching this, they could contact you.
If a physician is watching, they could certainly contact us and talk to us about it. It's been really fantastic, and not only are these participants who are receiving the food products benefiting, but we also have our other partners like Schenectady ARC. The ARC participants or clients have been coming and have been working with us.
That's great.
And they have been just fantastic folks who we've seen tremendous growth in what they're doing with us, and also tremendous growth in their willingness to try some of these new vegetables, like you mentioned before, kale. And we even have some people who
Kale is new,
because kale is new, but it's old. You know,
it's old.
It's for many years nobody really knew about it, and now
they didn't know what the health benefits are
Exactly.
of kale.
And I think the other thing too is what we're also looking to accomplish is access to these fresh fruits and vegetables. That in some of our stores, in some neighborhoods where people live, they don't have the access to those fresh vegetables. So in this case, they have access to it.
What happened to those old vegetable stores that you used to have on
the meat markets?
The meat market, they're putting them in the big stores, but used to be on Lower Broadway. There used to be 2 or 3 vegetable stores, and you'd go in, and it was all vegetable.
And people knew how to cook.
Yeah.
We had one individual said never had cherry tomatoes and thought, wow, this tastes like candy. This is wonderful, and it makes you feel good that you're sharing
and you're educating,
and you're benefiting,
and you're educating
exactly.
Well.
And that so that as they're cooking these vegetables and learning how to consume, eat, it also spreads to others that in their family.
Exactly. So if you're watching this segment and you're not going to get involved in the HealthShares, you can get involved by adding more vegetables to your diet and lots of beans and good stuff and mix them all up together, and you'd be amazed
how wonderful.
And add a few spices.
You've got
You'd be a chef.
Exactly.
Right?
Yeah.
Joanne Cocozzoli and Christopher Logue from the Cooperative Extension and Schenectady Health Department. Thank you both for being here today.
Thank you so much.